My name is Amy Pine, and I work at the California Department of Public Health. Today's offering of this webinar, where we will be spending the next 60 minutes-ish talking about the school and childcare roster lookup tool. This is being brought to you by the California Immunization Coalition and the California Department of Public Health. And we're very happy that you could be with us today. Cameron is advancing our slides, and I will just be saying next. Thank you so much, Cameron. In terms of some housekeeping notes, please note that we will not be monitoring the chat for today's webinar. If you have any questions, please use the question and answer box instead, the little Q&A bubble down at the bottom of the screen. We are not entirely certain that we will be able to answer all questions left in the Q&A today, but anything that we cannot answer is great information for us to see, because then it could be used to provide content for future FAQs that we post, or future webinars or office hours that we put on. The transcription feature of this webinar is turned on and currently activated. So if you would like it for this webinar to have transcription or closed captions, there's a little button at the bottom of your screen, hopefully, that says show captions. All of these sessions, today's session will indeed be recorded, and the slide deck will be sent out to all of you, and the recording will also be posted. Next. Again, just to reiterate that this is being brought to you by the California Department of Public Health and the California Immunization Coalition, a long-term and critical partner to the world of immunizations in California. We are putting on 3 webinars. One is today, and today's is geared toward the intended audience for today is local health jurisdictions. We'll be putting on another webinar on Wednesday, and the intended audience for that is primarily schools, and then another one on Friday, and the intended audience is primarily childcare and pre-kindergarten sites. It is not critical that you have to attend your intended audience webinar, but the content is slightly more customized for that particular audience. So you might not get all the exact messages that you need if you are here today and not representing a local health jurisdiction, but that's okay, because as I said, the webinars will be posted. So if you want to check out another one that you missed in the future, you'll have that ability. Next, going over today's agenda. I'm Amy Pine giving the welcome. Then we will hear from Catherine Flores of California Immunization Coalition. We will get some information about California policies and law related to school vaccination and the role of local health jurisdictions. We'll get a demonstration of the school and childcare roster lookup from Alana Hintz, who works for MCOR, which is the company that CDPH contracted with to produce SQUIRREL. We will have time to review a little key questions, and then just do a closing. So next, please. Okay, now I'm going to turn it over to Catherine Flores from the California Immunization Coalition. And thank you so much.
Thank you, Amy. Thank you so much to the whole team. I know I've worked with a lot of you on the call, but some of you I may not have met, or you may not have met me. And so welcome everyone. And thank you for being part of these important webinars. Our goal at the California Immunization Coalition is to, as it says here, achieve and maintain full immunization protection for all Californians to promote health and prevent serious illness. I used to say prevent disease, disability, and death, but people thought that was a downer. So I do say that a lot of time, because that is what we're doing. You can find us on immunizedca.org, and we've got a nifty website with lots of information, always looking for new information and input on our website, things that are going to make it easier for you to do your jobs. So we're a statewide 501c3 dedicated to ensuring that all folks have access, whether that's through making sure we have good policies, good information out there, working with providers on communication techniques, strategies, and supporting our local immunization coalitions. I'll talk about that in a minute. Mainly what we do, though, it boils down to 2 things, though. It's advocacy and education, in terms of advocating for policies that are going to help make sure we have high immunization rates, policies that are going to make it possible for people to access vaccinations, ensure that vaccination, it used to be about making sure vaccines are affordable or low cost. And we've, met that task. And education, lots of education, obviously, on all of the vaccines in the past, and COVID and flu all the time lately. So we work hard to partner with everyone that has a similar goal as we do. And we have amazing partners in California. But wanted to back up on, thanking Amy and the entire team that's going to present today on this partnership. And we've partnered with other folks on our on webinars, and we're happy to hear from you on some ideas and things that you're doing locally that could use a bump or could use our partnership, and vice versa. We'd love to partner with you. So briefly, our vision, again, ensuring all Californians have access to life-saving vaccines, but that's our mission, that's our vision, but really we want to make sure everyone, we're not focusing on the whole country, but we are focusing on, and we do recognize that diseases have no borders. And so keeping Californians safe helps lead others to be safe. Keeping others in the country safe helps lead to healthier Californians. So we work nationally with a lot of coalitions and other advocates to make sure we have good policies federally and statewide. So our vision is to improve immunization rates for Californians of all ages. We've worked really hard on policies over the years, taking the long view. Things don't change fast, right? When it comes to policy, sometimes it takes years to see the increases, to see the impact. But I think through our partnerships and our work, we've done an amazing job, and California's rates are among the highest in the country now in many areas. We encourage community-based advocacy, working with folks to make sure that they have the tools to feel more comfortable reaching out to their local school boards, city councils, but especially our state representatives. And of course, supporting our local immunization coalitions. We have about 10-ish. It kind of goes up and down a little bit depending on what else is going on in the state, but local immunization coalitions, some that have been going strong the entire time, some that have waxed and waned, so to speak, in terms of leadership. But we have a really dynamic group of directors right now, and I'm looking forward to sharing that another time, perhaps. And if you have any questions about a local coalition in your area, what's going on, please reach out to us. And then finally, providing educational opportunities for healthcare professionals. We create some content, but mainly we try to direct folks to what we believe are the most recent, compelling, pressing issues and resources, whether that's at the CDC, at the state, through our partners with Immunization Action Coalition, the Vaccinate Your Family folks, AAP, AAFP, all of the groups that we keep an eye on and send us information. We like to be able to make sure you know about that also. And if there's something in your area that we can include in our newsletter or anything, we're happy to hear about that. Next. And most importantly, as we're talking about today, the California Immunization Registry. Some of you know this has been a passion of mine for ages, and I am so excited about the legislation that has occurred that makes it a requirement now that providers use the registry. So many really great positive things happening. Again, long view, making sure that we have the policies in place, and we'll work out the details later. And the amazing, I'm such a huge fan because I worked with the registry for years, worked with Amy and others for years before I came to this job in the coalition. And it's taken a while, but everyone's doing amazing things, and I'm really excited about what we're going to hear today. But our focus and our coalition is to support the immunization registry in any way we can with ideas, information, and resources as much as possible. Next. So I'm just going to wind up with, if you know about social media, it's quite a mixed bag, some good, some bad, but we're on Immunize CA mostly here on Twitter, Instagram, and Facebook. So give us a follow and let us know where you're at, and we're happy to follow you as well. Thank you again for being here, and looking forward to all the questions and information. And if you have any ideas, thoughts, suggestions, next slide, get a hold of us at info@immunizeca.org. Many of you may have my email also, or Cameron's email. Wanted to also especially thank my colleague, Cameron Lawton, for putting this together today with our team. And now I'll hand it back to my colleague, Amy Pine.
Oh, yes. Thank you both, Catherine and Cameron, so very much for everything. And okay, I am going to jump into talking a little bit about some of what Catherine was just talking about, the this alphabet soup, so many acronyms. We have CARE, we have CARE Hub, we have SCRL. Like, what do these all mean? So CARE is the California, and for many of you on this call, this is very well known, but there are some that this might be relatively new information for you. So I'm going to give a brief overview. Catherine was talking about the California Immunization Registry. It is a secure, confidential, statewide computerized immunization information system that is for all California residents. There is a new law that went into effect of January 1st this year. The law is called Assembly Bill 1797, and it says that every single administered immunization in California must be entered into an immunization information system. CARE, there are currently 2 immunization information systems in California. There's one in the Central Valley called RIDE, and there is CARE, California Immunization Registry. The data from RIDE does get uploaded into CARE in almost near real time. So basically, any dose that is put into any registry in California does end up in CARE. CARE Hub is an umbrella platform or a portal where applications like the school and childcare roster lookup tool live. So CARE Hub is an umbrella portal. Right now, SQUIRREL, the School and Childcare Roster Lookup Tool, is the only application living in CARE Hub, but there are future plans for CARE Hub to host many more applications. So future enhancements will include the CARE medical exemption application, as well as the annual school immunization reporting portal. For years and years, that reporting portal has been on the Shots for School website, and it might still look like it lives on the Shots for School website, but it'll actually be living in CARE Hub. So, then the last acronym is SQUIRREL, the School and Childcare Roster Lookup. We like to call it SQUIRREL because that's why we got to create our cute little mascot, and just also because it's fun to say. But SQUIRREL is an application or a tool designed for schools and childcare staff to determine whether or not a student or a prospective student meets immunization requirements for the grade that they are entering or that they are enrolled in. And SQUIRREL communicates directly with CARE. So the information that is uploaded into SQUIRREL is taken out of CARE. So if you were putting in a student name into the School and Childcare Roster Lookup tool, it looks up all of the immunizations that are registered with that student in CARE. There's a direct relationship between CARE and SQUIRREL. Okay, next, please. So now breaking each of these down, California immunization, and I can go through these pretty quickly. CARE is confidential, it's statewide. It is accessible by providers, local health departments, and when I say providers, I mean clinical providers, local health departments, the Women, Infants, and Children program. And prior to this year, many school and childcare sites had read-only access to CARE. CARE does show all administered doses that have been entered by a provider. So data in CARE will be more robust depending on how long that provider has participated in CARE. If the provider has been using CARE for many years, hopefully all of the immunizations they've administered are in CARE. But there are a lot of providers that just joined now due to COVID and being able to offer COVID vaccine. They don't have a history of using CARE, or maybe they're just joining because of the new legislation, but they're not necessarily putting in their historical doses. So the data, again, will be more robust depending on how long a provider has used CARE or whether or not they have done historical data entry into CARE. CARE can be used to print out yellow cards, blue cards, or comprehensive histories of anyone in California. CARE is also what feeds the digital vaccine record. CARE does not have a really easy way to say ready or not ready for school entry. So that's one of the reasons that SQUIRREL got created. Next slide, please. So just because the digital vaccine record got mentioned on the previous slide, I thought, okay, maybe just remind people in case they don't know about the digital vaccine record. This is something new. It's just been created in the last year, actually. It started as a COVID vaccine record, but now it's a comprehensive vaccine record. It's an electronic vaccination record from CARE. It is an official record of the state of California, just like the yellow card is an official record. It includes a person's name, their date of birth, the vaccination dates, and all of the vaccines that they have received that are in CARE. It also includes future recommended vaccines and timelines. So it's all of the information that is in CARE can be accessed now via a digital vaccine record, and it's a great tool for all Californians. There's a link here, and there's also a QR code on this slide about how to access the digital vaccine record. Okay, next, thank you. Okay, now moving on to the next alphabet soup, CARE Hub. We already established that it was an umbrella platform where schools and childcare sites can access applications that communicate with CARE, like SQUIRREL. It currently houses SQUIRREL. Future enhancements will include access to CARE medical exemptions and the school and childcare reporting site. And this is a screenshot of what the homepage of CARE Hub currently looks like. And all of the green arrows that are on this are pointing to the aspects that, at least in terms of how my brain works, have direct relationships with SQUIRREL, the school and childcare roster lookup. So at the top, you have a way to originally register. And then once you've registered in CARE Hub, then you can sign in. The go button in the middle is also another way of signing in. And then down by the little squirrel mascot, there are a couple more really important things related to SQUIRREL, some information about how to register, and then also some actually, it's too small for me to really tell. I need to put on my glasses, but I think it's like frequently asked questions and how to use SQUIRREL. So from the homepage, feel free to check out the information of where these green arrows are pointing. Okay, and then back to SQUIRREL, the school and childcare roster lookup tool. It makes immunization record checking of children easy for schools and childcare facilities. It uses the pre-K and the K through 12 immunization requirements that are California law, and then it communicates with CARE to determine which students are complete, which students are conditional entrants, and which students are overdue. And those are the three primary categories that SQUIRREL uses: complete, conditional entrant, or overdue. It only accesses immunizations related to school or childcare requirements. It does not look at immunizations that are not included in school law. And why SQUIRREL? Well, it takes the guesswork out of who is eligible for entry and who is not. It makes it much easier for people who might not have a lot of history of just, making those determinations about like, oh gosh, they only have 4 DTPs, but did they get this one after their 4th birthday? And, it takes out all that guesswork for you. Another reason for SQUIRREL, you do not have to make any calculations for conditional entrants. It will tell you when the next dose is due. And so that's a wonderful thing. It's targeted to immunizations required for enrolling or staying enrolled per that grade. And it helps accomplish the implementation of requirements for school and childcare sites every year. Next, please. Thank you. Okay, now just switching gears a little bit, because prior to this, we asked for questions, and a lot of the questions that came in actually had to do with school law. So I'm not going to spend a lot of time talking about school law, but I just wanted to remind everyone who's listening that there is indeed a law in California that says California schools and childcare sites are required to check immunization records for all new student admissions for pre-kindergarten sites and kindergarten through 12th grade, and all students advancing to 7th grade before entry. This applies to all students, private schools, public schools, regardless of their age, and regardless of when they are entering during the school year or when they are starting school. just a reminder of that. Next slide, please. So, and then the way that the law is written, it says to unconditionally admit a pupil whose parent or guardian has provided documentation of receipt of all required immunizations, or if they have a permanent medical exemption. So an unconditional admit in SQUIRREL would be classified as a student who is complete. Conditionally admit any pupil who lacks documentation for unconditional admission if the pupil has commenced receiving doses of all vaccines required for the pupil's grade and is not currently due for any doses at the time of admission, or has a temporary medical exemption for some or all required immunizations. What this means is you are a conditional admit if you are up to date for that point in time, but not yet finished with all of the immunizations that are required by law. So say that the minimum interval between an MMR for the second dose of MMR is 4 weeks. Say that a student just got their MMR before starting school like 2 days ago. So they are current, they are up to date. They are not due for anything because they can't get their second MMR for at least another month. So that is a conditional admit or a conditional entrant. SQUIRREL would call that person a conditional entrant. And California law also says do not admit students who are overdue. If that student had gotten their first MMR 2 years ago, and they are overdue for their second MMR because their second MMR could have been given a month after their first. So you should not admit a student who is overdue. But anyway, those are the 3 classifications again: complete, conditional entrant, and overdue. And if I could have the next slide, please. Thank you. There is so much information about California immunization law on the Shots for School website. Again, we received a lot of questions in advance of these webinars about California school law, and it just said to me, gosh, people need to know more about the Shots for School website. And there are items broken down by childcare and everything that has to do with childcare law, all of the tools that you need to help implement the childcare requirements. It's broken down by TK through 12. It's broken down for college information. You have information about resources and training. You have information about reporting, and you have information about laws. There's so much information on the Shots for School website. I highly encourage everyone to spend many hours checking it all out and becoming familiar with it if you haven't done so already. Also, one of the things that exists on the Shots for School website are actual training modules for becoming an immunization expert, not only knowing how to determine whether or not a person is up to date, but also how to report. So all of these training modules are also new within the last year. Maybe you all don't know about them, but they're there and they're pretty neat. And it's like a great starting place for anyone who has recently found out that it's their job to check immunizations for schools. And it's also a great reminder tool for people that have been doing it for years, but might just need that little refresher course on the nuances. So these training modules are there. Okay, now after that school law sort of tangent, I'm coming back to SQUIRREL and the school and childcare roster lookup tool. Just wanted to give like this overview of the life cycle of a school and childcare roster lookup immunization report. So the school and childcare roster lookup tool is not a panacea. It's a tool in your toolbox, but it can produce reports of rosters of children, and on the report it can tell you who is complete, who's a conditional entrant, and who is overdue. And the way that it starts is, first you have to register or be invited to create a login for yourself, but you have to register in Care Hub because that's the umbrella entity that is hosting SQUIRREL. Once you're registered in Care Hub, then you'll be able to sign in directly to the SQUIRREL tool via the Care Hub. Once you're in the SQUIRREL tool, you go to the roster management dashboard, and there's a little screenshot here of what it looks like. It's like uploading a roster list, creating a roster list, or doing a single student lookup. But the roster management dashboard is, I feel like, you know, where all the action is for you. After you create a roster list, then your next step would be to create a roster list to check on multiple students. You can also do it for a single student lookup, but yeah, like that's not as the tool can access up to 4,000 students at a time on a roster list. So it's quite powerful. You create that list, then the next step is to upload the list into SQUIRREL. SQUIRREL then communicates with CARE. Oh, I was trying to make it so I said CARE on every slide and not CARE2. If you hear CARE2, it's just, I'm just using it interchangeably as CARE. A lot of us also call it CARE2 because it's like the second iteration of the California Immunization Registry, but it's still the California Immunization Registry. So for this slide, I should have taken the 2 off. I apologize, I didn't see that. Anyway, SQUIRREL communicates with CARE, and then you can view a list of your roster students results in SQUIRREL, and then you can take that report and you can work it however you want to work it to do whatever subsequent actions you see fit. If you've got a complete student, you don't have to do anything else. If you've got conditional entrants, you need to get to tracking them. And if you've got overdue students, they need to get a notice that they need to be immunized real soon or be excluded from school. Next, please. If you are using SQUIRREL and maybe there's not some data about students that show up in SQUIRREL, these are the reasons. They probably all have to do with CARE. If you can't find a student, they're probably not in CARE. If you have a student, but there are doses that seem to be missing, it's probably because whatever provider that student went to didn't use CARE or didn't do historical dose entry into CARE. Maybe they just started using CARE. Maybe they still don't use CARE. Basically, if the information is not in CARE, then it won't be in SQUIRREL. And if it is not to be shared in CARE, then it will be locked in SQUIRREL. So there are some families who have said, no, provider, the only provider that I want, the only person I want to be able to have access to my immunization data is you, my provider. I don't want to share it with anyone else. So when a record like that occurs in SQUIRREL, it will say locked. And then you'd have to go back to the family to ask them to provide an immunization history for you because you won't be able to access it electronically. We have talked on the next slide, please, Cameron, thank you. We have mentioned medical exemptions. And just wanted to reiterate that medical exemptions are also a part of California immunization school law. As of January 1st, 2021, all new medical exemptions must be through the centralized CARE medical exemption system. It's a computer system, and effective January 1st, 2021, there's only one form that is considered a valid medical exemption form, and it has to come from this CARE ME system. But prior to January 1st, 2021, there were some other paper forms of medical exemptions, and they could still be in circulation up until 2028. Anyway, there's a lot of information about medical exemptions on the Shots for School website because there's so many resources on the Shots for School website. Just wanted to say again that the CARE ME system does not communicate with SQUIRREL yet, but it will be communicating with SQUIRREL in the future. So if there is an immunization missing due to a medical exemption, that would currently not be reflected. Well, it actually wouldn't be reflected in CARE or SQUIRREL. It would only be reflected either in your school's like manual records or in the CARE ME system. Okay. Oh, just we want you to register for SQUIRREL, for the school and childcare roster lookup. We would love for you to do it before the end of this school year, because We want you to be all set for enrollment that's already happening for this fall, and also for future reporting. We want you to have the tools and the knowledge to be able to produce reports and feel comfortable using SQUIRREL. CDPH is also offering office hours and answering technical questions in May. So it's a good time to enroll now and see what questions you may have. Our intention is actually for SQUIRREL to replace CARE to all folks that previously had read-only access to CARE that worked in schools. So you've heard of us sending out announcements saying access to CARE 2 would be removed, and we still intend to do that, but we have not yet set a timeline. We do want to give at least 2, preferably 4 weeks notice once we have that timeline confirmed, but we do not currently have an actual date set. I also wanted to say that access or permissions for all clinical sites using CARE will not change in any way. So right now, if you are a school-based health center, for example, you are considered a clinical provider, and that means that you will always have access to CARE because of the immunizations that you administer and the fact that you are putting data into CARE. So nothing will change there for schools that have clinical access. Okay, local health jurisdictions. You're like, why am I here? Why should I care about CARE? Why do I need, why should I know about SQUIRREL? Why should I care about SQUIRREL? Well, hopefully this is answering those questions. It's a great tool for school and childcare sites to know about. Currently, we don't have an ID created specifically for local health jurisdictions to be able to access SQUIRREL, but we think that that's probably okay, just as long as you know how to answer basic questions about SQUIRREL. So basically, how to direct interested schools or childcare sites in registering at Care Hub, the umbrella organization, and there are really easy, well, we're about to see all kinds of stuff about Care Hub, and it's really not, the directions look kind of long, but it's just because they're laid out step by step by step, and it's totally not a big deal. It's just like, you know, you get a code back and then you register. And anyway, so that's step 1 is registering at Care Hub, knowing what SQUIRREL does and does not do, knowing that it reflects the data directly from CARE. If someone comes to you and they're like, well, I couldn't find this in SQUIRREL, can you look it up in CARE? You're not going to be able to find anything different in CARE because it's the same thing. It mimics the data that is in CARE. It's important for you to know when to suggest SQUIRREL. You don't really need to use SQUIRREL if you as a school have a student that you know is up to date. If you've got a student that you know is complete, and maybe you've got a student information system where you've got all the students that are complete, you don't need to look up those students that are complete in SQUIRREL. It would be better and more time efficient to focus on the students that you think are missing immunizations, or you don't know their immunization status. So that would be a good thing for local health jurisdictions to know as well. Okay, to know that rosters can be easily uploaded and produce reports on single students or entire groups of students. It would be great for local health jurisdictions to help schools determine subsequent activities related to those reports. So if a report comes back and then the school isn't exactly sure what to do with them, you can help schools like figure that out. And it's again going to be the classifications of complete, conditional entrant, or overdue. And if there are students that are overdue, you can help direct those schools and childcare sites to the notice of immunizations needed letter, because and go over the protocols that are in the California Blue Book, protocols that are all over Shots per School website about what to do once it's discovered if a child might be overdue, or if they're trying to enter and they are overdue. Again, reiterating that students should not be entering school if they are overdue for immunizations. And then finally, knowing where basic resources about SQUIRREL are located. So knowing what, and we do have a resource slide at the end of this webinar that Naveen will be showing, but basically, knowing the standard email address for the help desk and the phone number, basic information about how to access SQUIRREL on CareHub and what the dashboard looks like, and also how to access the user guide. We have links to all of that at the bottom. And that was it from me. But now we are going to turn things over to Alana Hintz from MCorp, and she is going to give us a demonstration. She's going to switch her screen. So we might just have a little pause here, which is perfectly okay. And I thank you so much for sticking with us so far.
Thank you, Amy. I believe we were going to use the PowerPoint slide for four of the, yep.
That is true. We didn't have to switch screens quite yet. I do apologize. Yep. Alana had some slides before we switched over. Sorry about that, Cameron. Thank you. Okay, back to you, Alana.
Thank you, Amy. Hello, everyone. My name is Alana Hintz. I'm a senior project manager with MCorp, and today I'm going to be demonstrating SQUIRREL. Welcome and thank you for joining us today. We are pleased to be demonstrating the school and child care roster lookup module in the CareHub portal. SQUIRREL is available to schools, school districts, and child care facilities to check the immunization status of a student by grade and vaccine schedule. Users can view each child or student immunization status online or by downloading an editable report that details which children have not met vaccine requirements and provides guidance on needed vaccines for entry into the selected grade level. Next. The contents that I'll be covering today will be how to register, roster management, and how to use single student lookup. Setting up an account takes less than 5 minutes with just your email address and a password you create. Next, how to register an invited user. Step number 1, receive the invitation. To be able to sign in to the CareHub, you must receive an invitation to register via email. If you are an org admin and have not received an invitation, you will be able to register, but when you attempt to sign in, you will be directed to the enrollment page. You will then enroll your organization by filling out the enrollment application. The application then goes through a verification and approval process. Once it has been approved, you will then receive an invitation email to be able to sign in. If you are a school or child care facility employee and would like to use the CareHub, please contact your organization administrator, ask them to enroll in CareHub and register your organization, and then have them invite you to register. Step number 2, from the CareHub welcome page, click the register button located at the top of the page. Step number 3, agree to the user access agreement. On the website, users access agreement page, read the care user terms and conditions, and then click I agree to the user access agreement. Step number 4, request a verification code. Enter your email and click the Send Verification Code button. A message appears stating verification code has been sent to your email inbox. Please note that it is very important that you use the email address from your invitation to register as shown here. Step number 5, get your verification code. Go to your email account, copy the code from the email that the system has sent, and then paste the code into the verification code field, and then click Verified Code button. Step number 6, create a password. Enter your password in both the new password and the confirmation new password field. You will then click Create button. This then takes you to the Welcome to Care Hub screen. Once you have completed these steps, log in and set up your user profile. You will then be able to access the school and childcare roster lookup. I will now be demonstrating the roster management feature and sharing my screen. Users can upload a roster file from their student information system or build one from a template we provide to request the children's immunization data from Care2. Care2 will then return the information on children who have records in the registry, and SQUIRREL then calculates any required vaccines that are overdue or conditionally met, giving the user an indicator of whether the child is complete on the necessary vaccines to SQUIRREL or to enroll into the school or child care facility. From the roster management page, users have the option to upload a file, build a roster, or search for a single student. Users can click on the Upload a Roster File button to upload a CSV file of student information. You can configure your student information system to export a file, or you can build a file using a template accessible via the Learn More link here. The CSV file needs to include the following required fields: the student's first name, last name, date of birth, grade, and student ID to help locate the student in Care2. Users can also add other identifying data, such as the school ID, the middle name, gender, and parent's first name to support school reporting. For incoming students without a student ID, users can enter in any number. Once you have uploaded a file, it will start processing and checking the Care2 immunization registry for students on your roster and their vaccine status related to school entry. Please note that larger files may take a while to process, but you can log off and come back later. The file will keep processing even if you are logged off. You will get an email notification when your file has finished processing. Also, please note that uploading roster files are kept for 1 year from the date added. When your file is fully processed, it will show a status of completed. You can also delete a file at any time by clicking the red trash can. It will then ask you to confirm that you would like to delete this file. Simply click yes, and the file then is deleted from your roster management user files page. To view immunization statuses of each student on your roster, click on the file name. If an exact match is found between the student information from your roster and Care2, the lookup will show you the student status for each immunization required for student or child care entry. The immunization status types include complete, conditional, locked, or overdue, according to the schedule, the tracking schedule shown here, pre-K or TK through K through 12. I'm now going to show you a conditional student to help you keep track of students who have been admitted conditionally. The file also shows you the date range of when the next dose will be due for the student to be able to stay in school and meet all immunization requirements. The roster lookup will identify students who could not be found in the immunization registry. You can try to find the student again by updating or refining their identifying data and uploading a new roster. Some students may not have immunizations in the registry, either because their primary care provider doesn't yet communicate to the registry, or maybe they have just moved and have not yet established their medical home. When this is the case, you will need to follow up with the student's parents or guardians for immunization information. Next, I will show you a student that is a multi-match. Possible multi-match. When the student information provided on a roster matches more than one record in the immunization registry, select the student that matches and is included on, it is then included on the report. So in this case, I do know that Nathan Wilder is the correct student to match, and I would then click OK. For easy to follow up, users can also use the advanced filter feature. The advanced filter feature allows you to filter by vaccine type, or there are additional filters such as the multi-match, lock records, or not found. Today I'm going to demonstrate not found and multi-match and click OK. This brings up the not found and not match and multi-matched students. You can also delete any student that you don't need to follow up on. This might include students who are fully up to date or do not need any further attention. To do that, you would simply click the student's name and then delete the record. Confirm that you want to delete the record. It then deletes that student from your roster. When you are satisfied with how you have arranged your file in terms of filters and students, simply click the download button shown here. And this will save a student report as an Excel file to your computer. SQUIRREL combines the CARE 2 student compliance report and the student immunization history report. The report offers additional information to assist schools and child care facilities in determining which immunization requirements have not yet been met. The report is easy to read and also color-coded. With this report, you are able to also filter or sort on any field. The report also has helpful and comprehensive comments on any overdue or conditionally met vaccines. From the roster management page, you can also build a roster. Here you can manually enter the required information for each student or child. First step would be to enter the file name. Step number 2, enter the last name, the first name, the date of birth, and then grade. Please note that the system accepts only the following values for grades -5 through 13 and K. Grade values -5, -4, 3, 2, and 1 are pre-K values. For example, -1, 1 year to kindergarten, -2, 2 years to kindergarten, and so on. Once you have chosen your grade and enter any additional information that you may want to, you would then click Add to the roster. Once you click Add to the roster, the student then will show up in the roster section below. From here, you'll have the option to either enter or delete that student. If you are satisfied with your entries, you can then click Submit button. This then takes you back to your roster management page, and you will notice that your roster, your manual builder roster, has then shown here in the user file. From the roster management page, you can also search for a single student. Enter the required information in the 4 search fields: the last name, first name, grade, and date of birth. Here you can also clear the search details by clicking the reset button. It simply clears your screen and you can re-enter your details. Once you have all your information entered, you would then click search. SQUIRREL then brings back the student information details. You can change the tracking schedule by clicking the down arrow. You can change it to either pre-K or K through 12. To open the student detail screen, click anywhere on the screen. On the student row, I'm sorry. Here you will see the student details and status of the vaccine requirements. To view the vaccine history and see the immunization record for the student, simply click on the vaccine history page button. On the vaccine history page, you can change the tracking schedule to view the missing doses for that tracking schedule. As noted here, it is defaulted to TK K through 12 and is showing missing doses of polio and DTaP. When I click on pre-kindergarten, you will note that the missing doses are now polio or MMR. From the vaccine history page, you can also view the immunization record, the required vaccine, the date administered, and the series if applicable. From the vaccine history page, you can also click and view the blue card. The blue card opens up as a PDF where you can then download it to your computer or print it. To close the vaccine history page, click on the arrow beside the student name. And the roster management page reopens and your single student lookup details are cleared. I want to thank you all today for participating. When a new product such as SQUIRREL is rolled out, it is always great for us to hear back and learn that customers like you, or that we love to hear your feedback and learn what customers like, or if you have any suggestions. You and your colleagues are an important part of that process, and we thank you. We are confident that SQUIRREL will indeed meet your needs, and thank you again. I will now turn this over to Naveen.
Thanks, Alana. I am Naveen Makhtoom, coordinator for school-located vaccination team in the California Department of Public Health. Thank you, everyone, for sending your questions. If we don't get time to go over all the questions today, we will cover them in the upcoming office hours. Next. So the first question is, are we required to use SQUIRREL? And the answer to that is, school and childcare sites are not required to use SQUIRREL, but we hope that you will all want to use it, and the time to register is now. Next. Can SQUIRREL print yellow cards? And the answer to that is no. SQUIRREL can print blue cards, not yellow cards. SQUIRREL is a tool specifically for schools and childcare sites and related immunization information. The California School Immunization Record, that is the blue card, is the only record that school or childcare sites may need to print. If a family is needing a yellow card, they should ask their doctor's office, or they can access California's digital vaccine record. Next. So what are the required fields for SQUIRREL? And the answer to that is student first name, last name, date of birth, student ID, and grade. For incoming students without a student ID, users may enter any number. Next. So the next question is, what if I am using the single student lookup and I do not know what grade they will be entering? So the answer to that is, if you don't know the grade for an enrolling student and are wanting to use SQUIRREL, simply estimate based on their age. Next. Next question is, how many people can be registered in SQUIRREL from school and childcare sites? The answer to that is, there is no limit to how many SQUIRREL users there can be from individual schools or childcare sites. Next. Is SQUIRREL connected to CareMe or the immunization reporting website? So the answer to that is not yet, but there are plans in place for SQUIRREL to communicate directly with both websites or portals in the future. Next. When should I use SQUIRREL? And the response to that is, SQUIRREL should be used anytime you are unsure of a student's immunization status for school entry. If you are using a student information system that shows a student as complete, it is not necessary to again look for that student in SQUIRREL. Next, and the last question is, where to get more information? So here's a list of active links and resources or contact information for the Care Hub and SQUIRREL Help Desk. Any questions can be emailed at carehub@cdph.ca.gov or called at 800-578-7889. Thank you. And now I'm turning things over to Amy.
And Amy is having trouble unmuting, but I wanted to say thank you again to Cameron Lawton for being the person in the background doing wonderful things. I also wanted to thank all of our speakers, Catherine Flores, Alana Hintz, Naveen Maktoum, and all of the other folks from CDPH that are answering questions in the background. I just wanted to reiterate that in terms of next steps, we will be offering office hours, and office hours will be an opportunity to have a short little demonstration, but also get more one-on-one question asking done. We'll be doing 3 sessions in May, all on Fridays at noon. So May 12th, May 19th, and May 26th. We don't have information to send out right this second about how to register for these office hours, but we're hoping that we'll be able to do that when we send out the slides from this webinar. And also, after this as soon as this webinar ends, you will receive an evaluation link. And we want you to please fill out this link and give us feedback. This will help us advise not only future content related to frequently asked questions that we can post about SQUIRREL, but it will also help us formulate the best way to put together the office hours and which topics really need to be gone over in office hours later in May. So please know that office hours are coming up, and please know that it's very important to fill out the evaluation link. I think there's just one. Oh, that's it. It was just to say thank you again so much for joining us. Thank you to the California Immunization Coalition for hosting this webinar, basically, and getting us all together to talk about SQUIRREL. When we do send out the slides, there will also be at the very end an appendix with more resources than you can imagine, not only related to SQUIRREL, but also related to school immunization law. So when you get the slides, make sure you check them out at the end as well. And we will also be letting you all know where this will be posted on the California Immunization Coalition YouTube channel. I hope that there's no one that I forgot to thank or anything that I forgot to say, but we are right on time at 1 o'clock. So I think we will adjourn. And again, I thank you all for being here today. And we hope to see you in May. Or maybe not. We answered all your questions, so you don't need to come in May. Okay, thanks everybody.
Great job. Thank you.